Assalamu alaikum dear students. Here we will discuss pharmaceutical analysis MCQs part first. Which of the following is not a branch of pharmaceutical analysis? Option A, qualitative analysis. Option B, quantitative analysis. Option C, biological analysis. And option D, clinical analysis. So the correct option is C, biological analysis. Explanation is, biological analysis is not a direct branch of pharmaceutical analysis. The main branches are qualitative, quantitative, and clinical analysis, may relate to bioanalytical testing. The primary standard substances are option A, hygroscopic, option B, volatile, option C, highly stable and pure, and option D, diluted easily. So the correct option is C, highly stable and pure. Explanation: a primary standard is a substance with high purity, stability, and known composition used to prepare standard solutions. The limit test is designed to identify and control the presence of option A, active drug, option B, toxic substances, C, impurities, and option D, solvent. So the correct option is C, impurities. The limit tests are designed to detect and control trace impurities that may be harmful even in small amount. Subscribe now and press the bell icon, never miss an update from early technologist. Which of the following is used is a primary standard in acid-base titration? Option A, sodium carbonate. Option B, sodium hydroxide. Option C, hydrochloric acid. And option D, sulfuric acid. So the correct option is A, sodium carbonate. Explanation is, it is a stable, non-hygroscopic compound used as primary standard in acid-base titration. So this is very important MCQs. The endpoint in a titration is detected by option A, precipitate formation, B, color change, C, volume change, and option D, boiling point. So the correct option is B, color change. Explanation: the endpoint is typically identified using an indicator that changes color to signify the completion of the reaction. Which indicator is used to titrate a strong acid with a strong base? Option A, phenolphthalein. Option B, methyl orange. Option C, thymol blue. And option D, bromothymol blue. So the correct option is A, phenolphthalein. Explanation is, it changes color in a basic medium, making it ideal for strong acid, strong base titrations. EDTA is most commonly used in option A, redox titration, option B, precipitation titration, C, complexometric titration, and option D, acid-base titration. So the correct option is C, complexometric titration. The EDTA forms complexes with metal ions, which is the basis of complexometric titrations. In complexometric titration, metal ions are determined by forming option A, precipitates, B, colored ion, C, soluble complexes, and option D, free radicals. So the correct option is C, soluble complexes. In complexometric titrations, EDTA form stable soluble complexes with metal ions. So, which titration involves an oxidation reduction reaction? Option A, non-aqueous, B, complexometric, C, redox, and option D, precipitation. So the correct option is C, redox. The redox titrations involve the transfer of electrons between oxidizing and reducing agent. Which indicator is used in Mohs method? Option A, potassium chromate. Option B, aerochrome black tea. Option C, merxeride. Option D, phenolphthalein. So the correct option is A, potassium chromate. Potassium chromate is basically used as an indicator of Mohs method, a type of precipitation titration for chloride determination. Mass spectrometry is used to determine option A, functional groups, B, molecular weight, C, pH, and option D, optical rotation. So the correct option is B, molecular weight. Mass spectrometry provides a mass to charge ratio useful for determining molecular weight. Which radiation is used in NMR spectroscopy? Option A, UV. Option B, IR. C, radio frequency, and option D, microwave. So the correct option is C, radio frequency. In NMR, radio frequency radiation excites nuclei in a magnetic field to provide structure information. Which of the following is not a chromatographic technique? Option A, TLC, B, GC, option C, IR, and option D, HPLC. So the correct option is C, IR. IR spectroscopy is a non-chromatographic technique unlike TLC, GC, and HPLC. Which detector is commonly used in HPLC? Option A, flame ionization, B, UV detector, C, thermal conductivity, and option D, mass spectrometry. So the correct option is B, UV detector. The UV detectors are widely used in HPLC for detecting compounds that absorb UV light. If you like this video, please सब्सक्राइब माई यूट्यूब चैनल। अगर आपको ये वीडियो पसंद है, बराए मेहरबानी मेरे यूट्यूब चैनल को सब्सक्राइब ज़रूर करें। In gas chromatography, the mobile phase is option A, liquid, B, solid, option C, gas, and option D, gel. So the correct option is C, gas. Explanation is, in gas chromatography, the mobile phase is an inert gas like nitrogen or helium. Paper chromatography is mainly used for option A, proteins, option B, gases, option C, volatile oils, and option D, inorganic salts. So the correct option is A, proteins. Explanation is, paper chromatography is used for separating mixtures like amino acid and proteins. Thank you for watching my videos.